welcome, and thank you so much for joining us today at the Aligned Modern Health Digital Doc Conversation on Thyroid Function. We are joined by Aligned Modern Health Functional Medicine physicians Dr. Joe Glowiak and Dr. Kristen Halland. Before I turn the presentation over to Dr. Glowiak and Dr. Halland, we like to give a brief introduction of what Aligned Modern Health is and what we do, just in case it's your first time joining us here at Digital Doc. Aligned Modern Health is Chicagoland's top-rated health and wellness service provider, offering support for the whole body, both internal and external medicine. We really aim to get to the root cause of why you're feeling what you're feeling and look at each patient as a whole individual, unique person without just putting a Band-Aid on one singular symptom or condition in a silo. We have 18 clinic locations throughout the Chicagoland area and service 8 U.S. states via telemedicine. Our services are supported by our physical medicine practice, which includes chiropractic care, injury prevention and rehabilitation, athletic performance support, and clinical massage therapy. We offer an acupuncture practice, which is really amazing to benefit physical pain, but also some intangibles like stress, anxiety, depression, sleeplessness, men's and women's health and hormone balancing, fatigue, migraines, seasonal allergies. We also have a nationally recognized fertility, pregnancy, and menopause support program. We also offer some other modalities under the traditional Chinese medicine umbrella like herbal medicine, cupping, and moxibustion. We round out our services with our functional medicine and clinical nutrition practice, which we like to say is a really great way to look internally to better understand why you feel what you feel externally. We work with a lot of gastrointestinal and autoimmune disorders, bloating, constipation, fatigue, migraines, sleeplessness, men's and women's health and hormone balancing, food sensitivities, weight management, and nutritional counseling. During the presentation, we do absolutely encourage questions. Please type them into the Q&A feature on Zoom, and we will answer all questions at the end of the presentation. At this time, it is my pleasure to welcome Dr. Joe Glowiak to the conversation.
Hi, everyone. I'm Dr. Joe Glowiak, and I do functional medicine out of the Aligned Modern Health in Lincoln Square in Chicago. And I received my training in chiropractic medicine at National University of Health Sciences here in Lombard, Illinois. After that, I went on to get a master's in human nutrition and functional medicine at University of Western States in Portland, Oregon. Some of the things that I love about practice, just like Janine was talking about, is collaborating with some of the other types of practitioners that we work with. And one of my favorite things is working with patients who have health challenges that they can't figure out. They've been to numerous doctors and seem to still not find the answer. And I think that thyroid conditions can be one of those things that we uncover together because of our unique view on thyroid function. And so I'm really excited to be here with my esteemed colleague, Dr. Halland, who I would like to introduce now.
Thank you. I'm glad to be here as well. My name is Dr. Kristen Halland. Thanks to everyone that's listening. I'm a functional medicine physician with Aligned Modern Health. I have a triple board certification, and some of my clinical interests include working on gut health cases, working with female hormones, and as many of us are finding out, working with the post-COVID and dysautonomia populations. Today, we're going to have a great organic conversation, a little bit of back and forth about the thyroid gland. It's a really common thing that comes up for us in the functional medicine practice. So just to give our audience kind of a big picture of what we'll speak about today, we'll start by talking about thyroid function, why it's important, what types of symptoms present. Then we'll talk about short-term goals for helping patients feel better quicker, and long-term goals, digging into the root causative factors of why these things happen anyways. And we will save some time at the end for questions that you can put in the Q&A box, please. So, Dr. Gloyak, when we're in the clinic, I feel like what I see most for the top 3 symptoms of a potential thyroid dysfunction are usually going to be hair loss, weight gain, and low energy levels or fatigue. But those are the top 3. We know there's more subtle symptoms. Anything that you want to add that's a little more sneaky of a clue to tip us off that we might be dealing with thyroid dysfunction?
Yeah, absolutely. There's numerous things that I listen for in my conversations when I'm first meeting my patients. Certainly, mood changes can go along with that fatigue. A lot of times, depression is a feature or anxiety. Difficulty focusing or brain fog is also very common, and it comes from the same sort of fatigue that patients experience. We talked about how that fatigue is maybe throughout the day, but a lot of times patients feel like they can't get out of bed even sometimes. So that's a red flag to me. With the hair loss, sometimes you can see a telltale sign, usually like the outer 1/3 of their eyebrow could become, a little bit sparser when the thyroid isn't functioning at optimal levels. And not to mention all of these other symptoms that could occur when instead of being in a hypothyroid state, the patient is in a hyperthyroid state. They might experience lots of palpitations, anxiety, sometimes tremors when they're trying to move in discrete ways with their hands and things, and sleeplessness. So those are some of the things that I look for when I'm speaking with my patients for the first time.
Same here. There's so many great subtle clues for thyroid dysfunction. All docs know that though, and we practice functional medicine. So I also want to tell our listeners a little bit about the functional medicine approach in case they're not familiar with it.
Yeah.
Our approach before we even get to treating a patient is doing really thorough work on the front end. We take a nice health history. We want to know about them as a whole person. We want to know all the stories. And we do a thorough evaluation. That could be physical exam, it could be laboratory based, but we like to use objective lab measures and what's going on in the person's unique chemistry to help us guide the treatment plans. And we do definitely treat with natural modalities. Not to say that we don't work with patients who utilize pharmaceutical approaches or that we would be against that at all. This is just what we're great at, is the natural aspect. Our treatment plans are always personal for our patients. For my organization, I like to think of the short-term goals and the long-term goals. The short-term being more about how could I begin to help this patient feel better quickly, ideally doing it the most natural way, if that's what's going to work best. And then my long-term goals are more about the root causative factors, doing that deep dive to find out why that dysfunction happened and what else is related to it. So our listeners, hopefully that helps give them a perspective of where we're coming from as we go through this information. So why don't we start with, if you'd like to, Dr. Glowiak, let's break down our initial evaluation of a case that could have thyroid dysfunction.
Absolutely. So, if the patient comes in and a lot of the symptoms that we just spoke of are present in their history, then we'll go ahead and we'll do an exam of the thyroid, which is a gland that's located right here on the front of the neck. And so usually we're pressing around, trying to feel whether there's any nodules. Nodules would be a site inside of the gland where things aren't functioning correctly. And if we find something there, then, and coupling that with the history, we go ahead and order some lab work. And the blood work that we order would definitely include the TSH, which some of us might have already been tested for with our physicians. But along with that, a certain number of other markers should be looked at: the T4 levels, the T3 levels, And when you're doing lab work, they measure both total and free T4 and total and free T3. The TSH is more of a hormone that comes from the pituitary gland, not the thyroid itself. It actually goes to the thyroid to turn up some of the function when T4 and T3 levels drop. So we're looking for maybe an elevated TSH for hypothyroidism, or high or low T4 or T3 levels, depending on what's going on, whether they're hyperthyroid or hypothyroid. Not only that, but in functional medicine, we try to expand it further and get more of the story of maybe why some of these things are off. So there are two antibodies, TPO antibodies, thyroperoxidase is the full term, and thyroglobulin or TG antibodies. And those two antibodies could be related to a special type of hypothyroidism that we are really good at helping in functional medicine, called Hashimoto's thyroiditis. And outside of that, then we also look at a T3 uptake or a reverse T3, but there's a lot of different things to consider. And I'm just wondering from you, Kristen, I know when I look at these labs, I try to narrow down the range a little bit because when the lab comes up with what's normal for these, they're looking at everybody in the population who hasn't been diagnosed with an illness. So they're looking for that diagnosis code in their research study to try to figure this out. And unfortunately, that's only the beginning. That's only, one piece of the puzzle. Just because someone wasn't diagnosed with an illness doesn't mean that they're heading for trouble when these things are a little out of balance. And so I try to, really hone in and come up with numbers that make sense. So for TSH, I know that the lab will say 3 to 5 is okay, anywhere from 3.0 to 5.0. And for me, I like it to be a little bit narrower than that, maybe, 1.5 to 3 or something like that instead of 3 to 5. So
yeah, I completely agree. It's important to differentiate. I think the idea of something being within a conventional medical range on lab for the general population versus in functional medicine, we also like to understand what is optimal. And a lot of functional medicine practitioners, that's going to be around 1.5 to 2.5 or even 3.0 for the TSH. And, I love the way you were talking about all the different potential markers that we could select to run or evaluate, because sometimes people think that TSH is the only option to evaluate a thyroid gland. It's definitely not. And there's a time and a place to screen things, but there's also a time and a place to thoroughly evaluate it. So yeah, I love that. And I agree about looking for those optimal ranges. And if someone was pregnant, for example, those optimal ranges would change again. They'd go even lower. So I also think the case context and the goals you have for your patient are important too. That might make you feel really specifically when you're working with someone and designing the goals.
absolutely.
We've covered the basics, I feel like, of what a thyroid dysfunction symptom chart would look like, what types of evaluations we would likely to be doing. So when we get into this type of dysfunction, now let's talk short-term goals and long-term goals. So let's do short-term goals when we think about how could we make a patient feel better if in fact they do have thyroid dysfunction? What types of things can be done to help?
Yeah, certainly we want to try to attack that fatigue right away. That's a really life-affecting symptom. And so if we can give them more energy, bring up their mood a little bit, I think that that's really one of the most important things. I think that's one of the earliest things to change as we're treating. Some of the other symptoms like hair loss might take a little bit longer. It takes, months for hair to grow in general. And so it might take some time to get the patient's thyroid to function in a very consistent way where that hair is growing really nicely. And same thing with weight management. one of the tougher things about weight management is that it's a multifactorial problem in most cases. And so thyroid might be a big piece of the picture, but we also have to consider things like inflammation and stress and other aspects of life that are difficult to control for. So
Yeah, that's why we really have to think about the patient as a whole person and all of those systems.
exactly. And I would say some of those things really do affect even the thyroid's function itself. So, so when we're looking at these patients, we're trying to create some changes, and usually a good functional medicine doctor will check their work to make sure that they're making progress. What do you think, Kristen and Dr. Halland, in terms of how to evaluate how often do you remeasure some of these markers that are in the blood work?
Well, I definitely want to remeasure them for sure, because I love when a patient says that they feel better, but I also want science to tell us that we're creating the result we think we are. So it depends on the severity of the case and the lab markers. On the early side, if I need to remeasure it quickly, I might be checking right away at 6 or 8 weeks. Or, if it's a very subtle problem, we might be remeasuring at the 3-month mark. If we're talking about thyroid antibodies in the unique Hashimoto's or autoimmune thyroid presentation, antibodies move slowly. So that might be on its own time frame. We might check an antibody at 6 months instead of a TSH, which could be at 6 weeks. So completely depends on the symptoms and the severity. But speaking of, that reminds me that I wanted to talk a little bit about those antibodies for a second. I think a lot of people are learning more about Hashimoto's from internet research, which is very exciting. And one question that comes up is, what if you have thyroid antibodies that are elevated, but your thyroid gland, the TSH and the other markers, is completely fine within range? Do you actually have Hashimoto's? What does that mean?
Yeah, well, I would say that if the antibodies are outside of the range that the lab gives for those antibodies, then you definitely have some autoimmune concerns, because that means your body is creating enough of those antibodies where it can have an impact on the function of the thyroid gland. And even though there hasn't been a change yet in the TSH or the T4 or the T3, I think it's important not to dismiss the fact that those antibodies exist, because if we could get those antibodies to come down, then we're able to save a lot of the function of the thyroid tissue. And I feel like that's where our position on thyroid illness is a little more unique from some of the other doctors out there. As functional medicine doctors, we definitely look for ways to have a positive impact on the immune system to reduce those antibodies so that we can preserve function. And that's an important distinction.
Yeah, we want to be more proactive and forward thinking instead of reactive after there's already destruction and dysfunction, ideally. Yeah.
There
So
could be different reasons why the TSH and the T4 and T3 look relatively normal still. Maybe you still have a lot of thyroid gland tissue that's functioning really well, and so you haven't gotten to a place yet where the lab ranges, where they're out of the lab ranges. But also in Hashimoto's, sometimes there's phases of Hashimoto's where more thyroid hormone is released in an uncontrolled way because of the destruction of those cells. And so when you have more of a thyroid storm where these hormones are being released in an uncontrolled way, it might look like you're almost hyperthyroid, or you might even have hyperthyroid type symptoms. And this can happen in phases for a while before any hypothyroid symptoms really come on.
It doesn't always happen overnight with the snap of the fingers like we might imagine it. It's definitely a process. So if The antibodies are one type of presentation for thyroid dysfunction. That's more about how the immune system is dysfunctional against the thyroid gland. But if the gland itself is malfunctioning, in the short term, Dr. Glowiak, I'm thinking all of the same things that you are. I'm thinking we could probably quickly boost energy, maybe some other things like hair or metabolism take a little bit longer. But from a short-term perspective, I think probably my two favorite action steps are going to involve nutraceuticals, which can be supplementation and therapeutic dosing. And sometimes you need to do something kind of therapeutic. You know, if you have a little bit bigger of a problem with a professional approach, there's so many nutrients that can impact the thyroid function. But in a dietary situation, I think we also have to consider that dietary changes could improve thyroid function. And one of the biggest ones is actually gluten, everybody's favorite. So I think, you know, on gluten, my thing really with that is that it's so similar molecularly to thyroid tissue that if your body is already confused, removing gluten will help clear that fog of confusion. I think that's probably more critical in an antibody case with Hashimoto's, but it's a potentially good strategies. So would you agree those are probably some of your go-to quicker short-term solutions?
Absolutely, because the whole reason that this autoimmune process starts is usually problems that occur in the GI tract. So gluten is famous for disrupting that lining that's supposed to be a good barrier between the food that you eat and the internal climate of your body. And if gluten is tearing down the connections between the cells lining the gut, then it's going to allow a lot more in terms of microbes that could possibly invade and cause more immune reactions, or even food sensitivities could develop from food particles, and your body just really doesn't even know that it's not a bacteria it's fighting against, it's a food that it's making an antibody against. And so one of the ways that we could start to help control the autoimmune process in the Hashimoto's type patient is by helping to restore integrity to the GI tract. And part of that would be avoiding gluten, that's for sure.
Mm-hmm. Yeah, our listeners know this topic probably pretty well, that destruction of the delicate lining of the gut is also called leaky gut.
Leaky gut.
And the immune system lives inside of the gut. So if you want great immune system function, you really have to consider the home that it lives in.
Absolutely.
And
But other than
speaking of considering other things, go ahead and say what you're going to say.
Yeah, I was going to say, other than the Hashimoto's reason for thyroid disease, there's other reasons why people's thyroids might not be working at optimal health. And I always look to the other gland that provides energy for the body. Which one is that, Dr. Halen?
The adrenal glands.
Yep.
They are small but mighty. The adrenal glands are two little glands that sit in our low back, and they produce hormones like cortisol. A lot of people have heard of cortisol. It's nicknamed the stress hormone. This has a huge influence on our thyroid gland. And actually, there's a lot of patients I find that have a lot of thyroid symptoms. Do a thorough evaluation. It turns out not to be the thyroid, and it was actually adrenal dysfunction the whole time. So yeah, so very similar set of symptoms. Treatment approaches in functional medicine, a little bit different, but these are still hormones. They need to get balanced, and yes, they do all work together.
Mm-hmm. Yeah, because a high cortisol level can impact how the thyroid functions. And the thyroid, when it's not functioning well, can also make it so that your adrenals need to work at a higher pace. And that creates an imbalance between how the brain and the adrenal gland and the pituitary gland all interact. And so that's where some of the things that were once adaptive, you know, coming from cortisol, some of the physiologic changes that cortisol produces start to become maladaptive then. And so people have a lot more fatigue. Some of the differences between a thyroid fatigue and an adrenal fatigue is especially how the sleep is affected, I would say.
Mhm.
So a lot of times with an adrenal condition, you have trouble falling asleep or staying asleep. And you might have that with thyroid too, but a lot of times it's a little more stimulatory in terms of you feel really turned on, like your consciousness is really there when you have the thyroid sleep issue. When you have the adrenal sleep issue, they use the term wired and tired because you're still
Mhm.
fatigued. You just can't get that rest. And so that's one of the ways that I differentiate that for patients.
And people with cortisol dysfunction often always wake to urinate. That is a classic adrenals sleep issue. The weight gain with adrenals is often concentrated in the middle, and it's more like swellings and puffiness type of weight gain. So yeah, there's a lot of subtle differences in there and a lot of similarities.
Yeah, and hair loss with adrenal dysfunction is usually coming from the fact that the female hormones aren't in balance because of that adrenal dysfunction. So it's a little different, the cause in that situation.
Yeah, and those are hormones too that control female cycles. So of course they're going to be related to thyroid and or adrenals.
Mhm.
So let's say supposing we have an adrenals dysfunction as one of our longer term causes to thyroid dysfunction. They're related in a case, let's suppose.
Mhm.
How would we approach the adrenals? For me, I'm going to choose something a little more therapeutic. There's a lot of great herbal interventions. You know, if listeners have heard of things like ashwagandha or maca, those are adaptogenic herbs that will help balance that and stabilize that adrenal cortisol response. There are vitamin choices like B vitamins. The adrenals love those.
Mhm.
Electrolytes are favored by the adrenals. And also blood sugar management. I mean, the adrenals like stable blood sugar to keep your energy up and work really well. So we have a lot of opportunities. Did I forget anything for our first line of adrenal support?
No, those things sound wonderful. I never want to forget, though, how important lifestyle is in all of this, too. Certainly, if you have a job that's really stressing you out or demanding too much, that's something that I encourage patients to take a close look at to see, is it worth it, to continue in that situation. Um, Exercise is important, getting enough exercise, but also not overdoing the exercise.
Yeah.
And also regulating your blood glucose with your diet, making sure to eat enough throughout the day every little while and not to go through. I find that a lot of people think that intermittent fasting might be the right choice for them, but unfortunately, based on their build, maybe their physique and their reserves, intermittent fasting may not be a good choice for them. It might be actually stressing them out because every time blood glucose levels drop and they go into that hypoglycemic state, the adrenals have to fire to motivate them to find their next meal, to also create some glycogen release in the liver. So a lot of times people who aren't eating enough might be more prone to these adrenal issues too.
Mm.
How do you choose some of those herbs that you were mentioning though, Dr. Hallen? Do you do any testing, or what is it that you do to determine how you're going to approach it?
Well, it really depends on each individual case. You know, for example, I might choose a herb like rhodiola that works really well with the female hormones too, if I'm trying to have kind of overlap in my treatment plans. Or, you know, I'm always a fan of testing. I want data as much as I can have it to make objective decisions. So there's a great test called the Cortisol Awakening Response, CAR for short. It's done by saliva. And this measures your get up and go of your morning adrenals. It's very well researched on Olympic athletes. So that's a great way that we can put numbers and visuals onto things that patients are feeling a little more subjectively. And the classic symptom that a patient is going to say with a dysfunctional cortisol awakening response is the phrase burnout. Or burnt out, fried nervous system. So we can actually quantify that, and that helps us make better treatment decisions.
Absolutely. Yeah, the cortisol awakening response is that wake up response that we see in a saliva test, right? So we have the patient collect vials of saliva throughout the day, and that way we could see the trend of the cortisol throughout the day. And so what I like to do is I like to match up which herbs they're taking at the various points in time where we're seeing the imbalances taking place in that test. So,
Yeah, this is why our job in functional medicine is so fun. There are so many puzzle pieces to put together. So, okay, so if we are thinking from a thyroid dysfunction case, we've got root causative factors for our long-term work, such as adrenal dysfunction. What else do we have? What's our next favorite long-term potential root cause factor when people's thyroids are not working well?
well, other than the nutritional deficiencies, nutrients like zinc and iodine and selenium, which all go into, creating healthy thyroid hormone balance. I also think about different nutrients that affect the nervous system because certain types of amino acids from the proteins that we eat go into making neurotransmitters that govern how the brain assesses where your thyroid hormones are at every moment of the day and will help to control whether TSH is being released in the proper proportion to what's going on in the body. And so I think that neurotransmitter testing could be a very good complement to assessing the adrenals, especially because the nervous system and the adrenals work closely together. So oftentimes I'll do another type of test, a urine test, to measure those neurotransmitters to make sure that those are all in the right place.
Yeah, I agree. Maybe we would do stool testing to evaluate the health of the gut, which controls about 20% of your thyroid's ability to function. It's really incredible how interconnected everything in the body is. And I wish that we had hours and hours with our audience to talk about every potential factor. But we don't. So I hope our audience was taking notes. There's a quiz at the end. Just kidding. So before we work on our questions from our audience, and please do send those in through the Q&A box, I want to ask your thoughts on one of the most common patient statements that I hear. And I know someone will ask this question. It's a great question. They'll say, well, I went to my other doc, perhaps it was a GP, maybe an endocrinologist, and they said that none of this is a problem. I have elevated antibodies, my thyroid's in range, there's no problem. Could it still be possible?
Absolutely. I know that there is research out there showing that if you have elevated antibodies, and even when the patients in the study with the elevated antibodies had normal TSH, normal T3, and normal T4 levels, their cholesterols were elevated, their lipid panel was out of balance. And so if the cholesterol is out of balance and it's affecting the metabolism from that perspective, I don't think it's hard to imagine that it might also be causing hair loss. It might also be causing your fatigue. Everything might check out in terms of TSH, T3, and T4. And part of it might be that your doctor even prescribed Synthroid or levothyroxine, and that's what's keeping your numbers in the right place. But just having those antibodies all by itself is a risk factor for your body to not function normally in terms of thyroid function. So that's one thing that I think is important to put out there to everybody, that even if you have normal TSH, normal T3, and normal T4, but you have those antibodies, it's something that we should talk about and try to address.
Yeah, I agree. And in my example of the question, the way that I often hear it in the clinic, the patient is saying, it's a problem for them. So we need to have that discussion and really explore it and get some good information on it. Thank you for sharing that with me. I think we will take some questions next in just a moment here. Please send them in through the Q&A box.
Mhm.
Thank you so much, Dr. Glowiak and Dr. Hallen. This was really amazing information. And to all of our guests, we do realize that this has been a lot of information to digest in some words and terms and phrases that may be new to you. We have recorded this presentation and we will be emailing it out to everybody who registers. So if you missed the beginning or the end, or if you want to hear a little bit again at a slower pace or watch on demand at your convenience, we will be doing some editing and then sending out a recording of the presentation later this week to everybody. We are taking questions at this time, and as folks are typing in a few more, we just want to make mention that if you are uncomfortable asking your question in front of a group, that is totally understandable. You can always schedule a free 15-minute consultation either in one of our clinics or via telemedicine by giving us a call at 773-692-6700, or you can visit us online at alignedmodernhealth.com. Aligned Modern Health is in network with most major insurance providers, and we are very happy to offer a complimentary benefits check if you would like to investigate your individual plan or policy to check coverage and costs prior to a full visit. With that said, I am very happy to turn it over to the Q&A portion. We have a lot of questions coming in. We will get through as many as we can in the time allotted. If we do not get to your question, again, please do feel free to request that free 15-minute consult because your questions and us answering them are important. Dr. Glowiak, we have a question concerning thyroid function and sex or gender. Does this condition affect only women?
No, it's more common in women, though, I have to say. It can affect men too, and there could be some reasons that are genetic that have to do with your immune system if we're talking about the Hashimoto's form. But also men are not immune to stress, and so if stress is affecting your thyroid, that's a big way that men can experience hypothyroid type symptoms. With women, I think it's more common for them because in the course of pregnancy and even just in their menstrual cycle, their hormones go through dramatic shifts compared to men. And I think that the connection between hormone shift and immune function is an important one to sort of look at when it comes to developing a condition like Hashimoto's. So that's why I think we tend to talk about women more with Hashimoto's, but I do have male patients that have Hashimoto's type of thyroiditis as well. What do you notice, Dr. Hallen?
Same, it absolutely can happen in males. But something that a lot of people don't realize about pregnancy in a female body is that, the thyroid and pregnancy hormones are so related. You're not going to, 4, 8, or 12 weeks after pregnancy, you're like, thyroid problem. That is a slow workup. It's going to be 6, 9, 12 months after pregnancy, and you're going to realize that those antibodies have been turned on. So in a postnatal case, that's definitely something we want to check up on and keep a close eye on, because that's a known association for development there.
Yeah, I would say it's always something that I screen for after my pregnant patients give birth. So.
Yeah.
Wonderful. Thank you both. I will just offer that we have a lot of questions that we want to get through. So the short and sweet answers here are going to be best, and our guests will definitely know that they can follow up with us for more information.
Sure.
There has been some talk about diet and gluten with thyroid dysfunction. If a patient has quote unquote regular or normal thyroid levels and has no tested food allergies, could there still be a suggestion to cut out gluten to improve function if there are no symptoms currently presenting?
I would say yes, definitely. Gluten intolerance or sensitivity is not the same as an allergy. So just because the allergies have been ruled out does not mean that you can't have a gluten problem. There are even cases where someone will not have a gluten sensitivity, but I'm still curious about and will explore and remeasure to confirm the role that gluten may or may not play in molecular mimicry, not just a allergy or intolerance.
Thank you. Maybe Dr. Gloyak, you can answer this next question. Are thyroid nodules related to thyroid dysfunction, or could they be independent of each other?
Well, a thyroid nodule is sort of a generic thing. So there's many different types of nodules. And so oftentimes having an ultrasound of the thyroid is important for assessing what kind of nodule it might be. Oftentimes the radiologist reading the ultrasound will help to make a determination whether those nodules need further workup, because some nodules could be associated with the Hashimoto's autoimmune response, but some could also be related to thyroid cancer. And so it's important that if there's a determination that the nodule is potentially one of the cancerous types of nodules, the next step would be to do a fine needle aspiration where they take some of the fluid from that nodule to have it assessed to see what it looks like, whether there's any risk there. And that's usually when we would transition from working with them from a very holistic, conservative standpoint to referring them out to an endocrinologist to get a more in-depth check on what's going on with those nodules.
Thank you so much, Dr. Gloyak. Dr. Hallen, we have a question here, wondering if it is quote unquote normal to have symptoms that appear both on the hypo and hyperthyroid symptoms list.
That's a really interesting question. I have seen this symptom presentation in patients a number of times where they have both aspects. So I wouldn't say that that's very common. I definitely would not say it's normal or appropriate, optimal, what we're looking for, but it is possible that that's a real thing.
Wonderful. Thank you so much. We've talked a lot about testing during the presentation, and we have several questions about testing, about quote unquote objective testing, kinds of the things that we do, which we have talked about a little bit. Are there any tests that we can recommend guests ask at their own doctor's office for, and or when should they seek out a specialist like Aligned Modern Health?
Dr. Gloyak, do you want to field this one?
Well, the basic blood chemistry that we talked about, the TSH, the T3, the T4, a lot of doctors will do some of those, and they may not do the full workup that we do. So if you're not exactly sure what to think about what your doctor explained to you concerning some of the initial measurements of a TSH, a T3, a T4, then you can always turn to a functional medicine doctor to help explain that a little bit more and maybe do some other testing. I think that there is a great potential. I think that more medical doctors are starting to learn a little bit more about the functional medicine approach as well. And so a lot of medical doctors are actually doing more of a functional medicine approach than there used to be. So I think that it's changing. We're sort of changing the face of medicine in that way. But I think most functional medicine doctors would be very comfortable helping you out with that kind of testing as well.
Wonderful. Thank you so much. Guests, we do have several questions here that are really personal and individual to the guest asking them. So for questions about elimination of certain foods, or questions about certain nutrients and minerals, or food items like turmeric, biotin, iodine, etc., or folks having questions about having a history of hypothyroidism in their family and some specific questions about that. For those questions, we do absolutely recommend that you schedule a free consultation with a provider, because those are really specific to you, and that will allow the provider to address those questions to you as an individual versus giving a very generalized answer that's appropriate for an audience. So we do have several questions here that are really great questions, but again, more appropriate for an individual consultation. With that said, that does bring us to all of the time that we have for today. Dr. Glowiak and Dr. Hallen do have patients to get to, but there are still some really great questions here left unanswered. We do apologize for that. And again, if you want more information, please feel free to give us a call or visit us at alignedmodernhealth.com. Dr. Glowiak, Dr. Hallen, thank you so much for joining us. And to all of our guests, thank you for joining us as well. Our next digital doc presentation is coming up on October 5th, Wednesday at noon, and the topic is desk ergonomics and stretching appropriate for home or office. You can register online at alignedmodernhealth.com. Thank you so much for joining us. We hope you have a great day.
Thanks. Bye-bye.
Thank you. Bye, everyone.